Assalamu alaikum everyone. My name is Madiha and I'm currently residing in Australia. I recently passed my ADC practical exam and I got my registration. I decided to make a couple of videos about my ADC journey, and I was recently a lot of people actually approached me about what can be the other options for them if they cannot pass their ADC but they really want to practice dentistry or work in the dental industry. So whatever my knowledge is, I just wanted to make like a video for you guys to be able to help a little bit. So the first option is, if you really want to work here as a dentist and you cannot pass your ADC exams, you could actually take admission or get admission in one of the universities here in dentistry. So you would be looking at doing a whole 5-year course again. The admissions are usually very competitive, and you'll be given admission on your GPA that you achieved in your last degree. So if your last degree was dentistry, which you did from overseas, they would be looking at what were your grades in that, what if you were a high achiever. Some people do something like taking admission in a course like biomedical science or Bachelor of Health Science in the university. If they can't get into dentistry straight away, so they opt for something like this, a Bachelor of Biomedicine or Health Science, and then they do 1 year of it. So if they get like a really good GPA, they can then in the next year, in the following year, take admission in dentistry. So that's another option. So some people take admission into the dentistry course, get into the dentistry straight away, and meanwhile they are taking their ADC exam as well. So they keep on taking their ADC exams, the Australian Dental Council exams, which you have to do for registering here, and they keep on studying as a dentist as well. So even if in the second or third year they get through the ADC, they just get the registration straight away and start working. So that's one option, that they're simultaneously studying dentistry here and doing the ADC exams as well. So at the end of the day, either you will pass in those 5 years or you will be given a degree anyways at the end of the 5 year, hopefully. So that's one option. The other option is about if you are interested in like research or higher education. So there could be options like doing an MPhil or a PhD. I know some overseas trained dentists over here who are currently doing their PhD in different subjects related to dentistry, like implants or perio. So again, you can get a scholarship for it, but they are again quite competitive. So what basically will make you stand out is your how many articles you have written, or what's your experience in this particular industry of research, what topic do you want to pursue, and if you have a supervisor already, so you contact the supervisor, and then they arrange like a meeting for you, or you can they might be able to do like a Skype or a video sort of like interview, and then meet you in person and ask why do you think you are like suitable candidate for it, or what makes you so interested in our topic, why do you want to work with us on this particular topic like research. So at the end of those 2 or 4 year program, you'll get your degree, and you will be able to either work as a faculty member in a university or as a research fellow like in a lab, or as a supervisor for continuing research. So you become the supervisor, and now you are helping someone else complete their PhD. The average salary, if you're working in a university as a faculty member, can be is something like somewhere like $100,000 a year. So that's one option. The other option is dental assisting. So if you're really passionate about dentistry, meanwhile you're continuing and you're taking your ADC exams as well, but you want to stay connected with the field, you can work as a dental assistant. You can do like a certificate 3 or 4 from TAFE, or there are many institutes which are offering this certificate. So you can do this certificate of dental assisting and start working here as a dental assistant. Sometimes you don't have to do the certificate, you just make a good resume and try to approach different people, and they will be looking at your experience from overseas or your communication skills and things like that, and you can start working as a dental assistant straight away. Again, the average salary is about $60,000 to $70,000 per year. It's about $28, starting $28 per hour. Some people, after working a couple of years as a dental assistant, can become practice managers as well. So you could be a practice manager and manage the whole practice, and like rostering of the dental assistants, the dentist, looking after the patients if there are any issues with that, and you can earn a little bit more than the dental assistant. So that's another one. And one more option is about continuing your study. So if you want to do like a Bachelor of Dental Hygiene program or a Diploma of Dental Hygiene, at the end of the day, you would be registered with EPRA, and you could practice as a dental hygienist. So the bachelor program is 3-year program, but there is like a diploma, advanced diploma, or a diploma of oral hygiene and oral health as well, especially in TAFE in Adelaide. Who offer recognition of prior learning to overseas trained dentists as well. So if you are an overseas trained dentist and you have, because you have already studied so much, so they would be able to give you some sort of like credit transfer, so you don't have to do the whole process. It's a 2-year program, but you can do it in 1 year or 1.5 year as well. So at the end of the day, you would become a dental hygienist. You will be working alongside a dentist, and all that you are doing basically is checks and cleans, but you are like you are able to see patients, and you can earn about $60,000-$70,000 a year, and that's the starting. If you are working in a regional area, you can earn more, or if this is your first year and you've just started, after a couple of years, depending on your experience, you might be looking at something like $80,000-$90,000 per year as a dental hygienist. So that's another option. And another thing is oral health therapy. So I'm not quite sure if a lot of you have heard of it. It is another option, another 3-year bachelor program, or you can do like an advanced diploma or diploma of it. But the bachelor program, at the end of the bachelor program, you will be registered with APRA, and you will be doing all the basic procedures. So you are allowed to do like fillings and extractions and checks and cleans, but up till the age of 18 or 21 years. So it really depends on which state you are in. Some states, they are offering you to do the procedures up till 18 years of age of a particular patient, but in certain states, they are a bit lenient, and you could practice and you could do patients up till at the age of 21 year of age of the patient. Again, in this in Bachelor of Oral Health Therapy as well, at the end of the day, you become an oral health therapist, and you're basically dealing with improving the oral hygiene of the patient. And you can earn about $45 to $50 an hour as a starter, and later on it keeps building up with your experience basically. So another option is about dental technician or dental prosthetist. So here in Australia, they have these denture clinics which are usually dealing with dentures or doing like lab work. So this is another option if you're interested in it and are happy to work in the lab. What basically you need to do is, again, it's a 3-year program, and in some universities it's for 4 years, dental technician and dental pros. You basically study pretty much everything like the anatomy, and then mainly you're focused on doing your pros work. And again, there are some people I know who are dental prosthetists, and they've actually opened up their own practices. So you can open your own practice if you're a dental prosthetist. And some people would actually like do a mobile sort of thing, so they would go to aged cares, and because there are lots of patients in aged cares who need dentures, so they would work there with them. and deliver their service, like they're on call, and they you can book an appointment with them, and then they come to your place basically. So you can earn about 25 to $38 an hour, and 60 to $70,000 a year. And if you're opening up your own practices, then of course there's always chance to expand. The last one is, or the last one that I know at least, is if you want to teach like in a university, um, only on the basis of what you have studied overseas, because you're an overseas dentist, so you could approach universities and see if they are willing to hire, go through the process of their interviews, and you can teach in the simulation labs, or you can teach the first year students the basic anatomy and histology and subjects like that. So in the simulation labs, basically the students are working on the mannequins or the sim units, so they're not dealing with patients, so you can supervise them and you can teach them different subjects, endo, pros, operative. But if you are if you're wanting to be like a supervisor in clinic and you want to work with students in the clinic, then you would be looking at doing your ADC or your dentistry program and get the registration, because you have to be registered with APRA as a dentist to work in the clinic and supervise the final year students. So I really hope that you find this video useful, and please do give some feedback on how did you find it. Share it with your friends and colleagues who might be looking at options and are trying to explore other options if they want to practice here. Thank you so much. Until next time.